What if I told you that some of the earliest signs of multiple sclerosis can be so subtle that people ignore them for months or even years? A little tingling in the hand, temporary blurred vision, unexplained fatigue. Many people dismiss these symptoms as stress, overwork, or lack of sleep. But for some individuals, these seemingly minor symptoms may be the first warning signs of multiple sclerosis, commonly known as MS. In today's video, we will discuss the early symptoms of multiple sclerosis that most people ignore, why they occur, and when it's important to seek medical attention. Let's begin. Multiple sclerosis is a condition in which the body's immune system mistakenly attacks the protective covering around the nerve fibers, called myelin sheath. Think of myelin as an insulation around an electrical wire. When this insulation becomes damaged, communication between the brain and rest of the body becomes disrupted. As a result, a person may experience symptoms affecting movement, sensation, vision, balance, thinking, and energy levels. MS often affects young adults between the ages of 20 and 40, although it can occur at any age. One of the biggest challenges is that early symptoms are often vague and easy to overlook. One of the most common early symptoms of MS is overwhelming fatigue. This isn't ordinary tiredness after a busy day. Many people describe it as feeling completely drained even after a full night's sleep. Everyday tasks such as climbing the stairs, working, cooking, or concentrating may suddenly feel much harder. Because fatigue is common in modern life, people often blame stress or poor sleep and don't seek further evaluation. However, persistent and unexplained fatigue should never be ignored. Another common early sign is numbness or tingling. Some people notice a pins and needles sensation in the arms, legs, face, or fingers. Others may experience reduced sensation or patches of numbness. These symptoms occur because nerve signals are not being transmitted normally. Often, the sensation comes and goes, which makes people believe it's temporary and harmless. But recurrent numbness deserves medical attention. Vision changes are among the most important early symptoms of multiple sclerosis. Some individuals develop optic neuritis, which is inflammation affecting the optic nerve. Symptoms may include blurred vision, reduced color vision, eye pain, especially during movement, partial vision loss. Others may experience double vision. Because these symptoms sometimes improve on their own, people may delay seeking medical care. Never ignore unexplained vision changes. Have you ever felt unusual, unsteady, or off balance without any obvious reasons? In some people, multiple sclerosis affects the parts of the nervous system responsible for coordination and balance. Early symptoms may include feeling dizzy, unsteady walking, clumsiness, difficulty maintaining balance. These symptoms may be subtle initially but can gradually become more noticeable. Muscle weakness is another symptom that often goes unnoticed. A person may feel that one leg is heavier than the other. Others may notice reduced grip, strength, or difficulty in performing the routine task. Weakness may fluctuate, making it difficult to recognize the pattern. Persistent weakness should always be evaluated by a healthcare professional. Many people with MS describe experience brain fog. This can include difficulty concentrating, slower thinking, forgetfulness, trouble multitasking. Brain fog can affect work performance, studies, and daily life. Unfortunately, People often assume these symptoms are caused by stress or aging. In some cases, they may be early signs of neurological dysfunctions. One reason MS can be difficult to diagnose early is that symptoms often come and go. A person may experience tingling for a few days and then feel normal again. Vision problems may improve. Fatigue may fluctuate. This pattern leads to many individuals to ignore the symptoms until additional neurological problems develop. Early recognition is extremely important. If you experience persistent numbness, unexplained vision weakness, vision changes, balance problems, severe fatigue, it is important to consult a healthcare professional. These symptoms do not automatically mean you have multiple sclerosis. However, they deserve proper evaluation. Multiple sclerosis can be challenging, but early diagnosis and treatment can make a significant difference. The key message is simple: listen to your body, don't ignore persistent neurological symptoms. Awareness can lead to early intervention, better management, and improved quality of life. If you found this video helpful, please like, share, and subscribe to the channel for more evidence-based information on brain health, stroke rehabilitation, neurological conditions, and recovery. Thank you for watching, and I will be there with the next video.